Hello, ladies and gentlemen. Welcome back. Welcome back. Welcome back. I'm your host, Dr. Leroy Simpson, along with Dr. Sandra Rabor. I guess therapy is the theme of the day. I've had two relaxing sessions so far, and from the looks of this one, I am going to have three. So I got to tell you, this is such like a good thing that, I'm going to feel good after this. I don't know about you. So without further ado, here is Dr. Chris Tex, an associate professor who I think wants to educate and enlighten us on the art of music therapy. So Dr. Tex, let's see what you got for us.
Sounds good. Thank you, Dr. Simpson. Hi, everyone. I'm Chris Tex. I'm a full-time faculty member and course lead for many of our public health courses within the Master of Public Health program here at UAGC. I'm excited to share with you over a brief time the power of music therapy. I want to thank Drs. Rosser Majors and Sutler Cohen for hosting the March 2024 Culture of Care Summit. If you look closely, you can see that I must have been thinking about music because I get that glitter in my eye when I think of the benefits it has had on my life. I'm sure my love of music began earlier than second grade when I was enrolled in drum lessons. I also took piano lessons for a few years. I went on to join a variety of marching, jazz, and orchestra bands throughout elementary school and college. I even received a percussion scholarship throughout my undergraduate years. I've also been in a variety of successful bands outside of academics. Although the COVID-19 pandemic challenged the world collectively, I was still able, like many, to continue seeing the power of music therapy. I don't like assuming things, but I will assume that you all have at least one song you really enjoy, or you at least appreciate what the power music can do for people. Today, we will be discussing music therapy, what it is, its effect on the brain, as well as the results of an interview I conducted with a board-certified music therapist. We will also discuss applications of this form of therapy by reviewing some research. First, I'd like to poll everyone briefly to serve as a starting point for entering this area of health and wellness. While this isn't a philosophy or physics presentation, I would like to paint the following picture for you. Imagine your favorite music performer is playing a concert in your town. However, you can't attend because you're taking care of a family member recently diagnosed with COVID-19. Let's say everyone in your town ended up getting COVID-19. Therefore, no one attended the concert. Was there music at the concert? I'll give you all 30 seconds to select your answer. So here is the poll being put out there. Was there music? So can there be an unperceived existence? Can we know the unobservable? What is sensation versus reality? So I'll give it about 5 more seconds and then we'll end the poll. Okay. I don't know, can you all see the results?
Yeah, we can see them.
Okay, good. So it seems like 77% says there were music, 23% said maybe. So very good. Let me go on here. Sorry. There are a variety of ways that we can look at this situation, and each way deals with perceiving or lack thereof. Basically, we are wanting to know how sound fits into the situation. We sense sound as vibration from the environment. Our ears interpret this vibration. Our nervous center ultimately is where we interpret this sound. Therefore, to answer our poll question, if you were at the concert to hear your favorite musician sing or play their instrument, and then sound occurred because sound is vibrating through the air and you were able to hear the music. However, if you weren't there, then there would be no sound for you to hear. This likely brings up more questions than answers about metaphysics. The first question is somewhat a reiteration of the example I just pointed out, in that there's a view that sound is only present if someone can hear it. Other people hold the view that we should not assume that what we observe is the same as what is not seen. For example, if we stopped existing, sound would continue even though no one would be there to know that it was occurring. Still, there are some people who question whether there's a variation between what is and what something appears to be. For example, we may think of sound as a difference in pressure, which spreads through matter in the form of a wave. In our concert example, if the concert existed outside of our perception of it, we would not be able to confirm whether the concert occurred. This means we need to think about what existence means. Does it mean something exists, or are we perceiving that it exists? What music therapy is. This type of therapy involves clinical as well as evidence-based research. The goal of using music interventions is to assist people in achieving goals set by themselves. Music therapy involves working with a licensed music therapist that is graduated from an approved music therapy program. People interested in this field can obtain undergraduate, master's, and doctoral degrees. It is recommended that people who go into this field be proficient in singing or playing a musical instrument. They should understand theory and historical context of music, as well as counseling and other healthcare skills. There is a 6-month internship that consists of 1,200 hours. After completing the program, the music therapist becomes board certified. What do musical therapists do? Although there are many things that they do, I will briefly review some important points to remember. One of the main things that they do is focus on assessing any strengths or weaknesses the person may have regarding domains in their life. These can be areas such as physical, social, emotional, and cognitive abilities. Depending on the person's needs, there are times for individual and group sessions to interact with music. In this environment, people can use interventions like improvising, listening to, writing, and performing music. As they continue interacting with music, they strengthen their learning. Music therapists also aid with treatment and continual evaluation, while also helping with any follow-up or discharge plans. You may have heard of music therapy before. However, you may not be aware of various ways it can help people. With this being a Culture of Care Summit, you can assume we will be talking about how it promotes wellness. The COVID-19 pandemic, along with the current measles outbreak, And all the other stresses in our lives are examples enough that music can soothe us. From being able to express feelings to improving the ability to speak or be active, music can teach us many things. We've discussed what music therapy is. Let's spend a moment reviewing common myths that people may hear about music therapy. First, some people may think that to be effective, the person receiving the therapy needs to know how to play a musical instrument. This is definitely not the case. I have many friends, and I bet you do too, that simply love listening to music because it makes them feel good. Some of my friends don't play musical instruments. However, they still enjoy the power of music. In reflecting on where music therapy shows benefits, we have no further to look than to the circle of life. Families, military personnel dealing with mental and physical pain, people diagnosed with brain disorders like autism, dementia, and Parkinson's disease, to people experiencing the end of their lives. Music provides relief for many. From my experience as a newborn screening and birth defects epidemiologist for a state health department, I have seen the importance of the way that hearing makes in families. It's important to families. A second misconception that some people may have is that specific styles of music provide more relief than others. Any type of music can be therapeutic. As you know, two people can listen to the same music and have different reactions. Take, for instance, this clip from a show I did with my band in California. You can tell I was having a good time, as were some of the people there. However, you can also see the person actually holding their ears. So apparently he may have not liked the music, but a lot of other people did. So when working with a music therapist, it's important for the person that is receiving the therapy to also be involved in choosing the style of music that they feel provides relief. The reasons for therapy, as well as treatment options, are discussed. Ultimately, the goals of music therapy will be discussed in collaboration with the musical preferences so that the entire experience provides benefits. A final misunderstanding regarding music therapy is that if you can sing or play a musical instrument, it is considered music therapy. From a few slides ago, you know that music therapists complete board certification after completing rigorous academic and clinical training to provide their services. Unfortunately, with improper training, great harm could occur. Therefore, continuing a myth like this harms people. Music therapy requires continual advocacy so that people understand what music therapy is. Here's another poll, but it's more putting your thoughts in the chat. I posed the question, actually that's not the right poll. This is still slide, this is not slide 14. This is just a, in the chat if you want to put any misconceptions that you've heard regarding music therapy. Perhaps other people have heard similar things. So while developing this presentation, I wanted to merge my love of music and public health together. I wanted to learn more about music therapy and share this with you all. I wanted to actually go out in the field and interview someone that has direct knowledge of what it's like being a musical therapist. So I had the pleasure of interviewing Nick, a master's level trained music therapist who has been working in the field for nearly 10 years. I asked them about their philosophy about music therapy, and they mentioned that specific goals are a foundation for improving social and emotional health. However, they stated that it is important to always be working towards therapeutic goals with clients. Otherwise, I'm simply performing music. This makes sense. However, it is surprising to hear a musical therapist state this commonly held misconception. Nick mentioned a variety of benefits, some that were mentioned earlier. Music therapy improves cognitive and physical functioning. Nick's therapeutic practices rely on research. In fact, they mention that they continually seek out evidence-based research to improve their interventions. Working on a team is an important part of the music therapist's role in providing services to their clients. In fact, they stated that they play an active role in providing care plans when consulting with other members of the health team. When I asked them to recall some of their proudest moments working in music therapy, they mentioned that it's when a dementia patient would light up when their favorite song came on. Another example was when a person started singing after not being able to talk before. To understand music further, we can look at our brain and review some of its functions. Looking at it, it amazes me how this organ is responsible for so many things. As you can see, the brain is divided into 4 lobes. The frontal lobe, consisting of the prefrontal lobe, is responsible for our ability to plan and think. Our temporal lobes are where we recognize sound, music, as well as objects and faces we see. Our temporal lobes are where we recognize sounds, music, as well as the objects and faces we see. Here, you can also see our occipital lobe. This lobe is important in how we see things. The final lobe of our brain is the parietal lobe. This lobe is responsible for how we see ourselves oriented in space, as well as our calculating abilities. Have you ever thought about whether your friends hear the same music you hear? As we discussed in the beginning of our music therapy presentation, vibrations from a noise travel through the air until it reaches the eardrum. It's named this because the membrane is stretched out like the head of a drum. And here is one of my snare drums that I typically use. You can see how hitting the drum produces various sounds. What you're hearing are the vibrations hitting your eardrum. From here, the vibrations travel to the brain so that the noise can be interpreted into sound. In fact, music is made of sounds that are carried through the air. We hear because of the difference of air pressure. Once inside the cochlea, many different cells interact to changes in pitch, timbre, harmony, and melody. So here's our poll, slide 14. Are we using our left side or our right side of our brain when listening to or playing music? So I'll just give this about 20 seconds. I have a couple of more slides, and then I will take some questions. Okay. So the poll is ended. 31% of you said the left side, 31% said the right side, and 38% said both. Well, it turns out that we use both sides of our brain when listening to or creating music. As you know, the right part of the brain controls the left side of the body and vice versa. We use our right side of our brain when being creative, such as engaging in music or artistic activities. We also use this part of our brain when orienting ourselves in space. We use our left side of our brain when we talk, reason, calculate, or write. As we've been talking about the power of music, you may have been reflecting on a time in your life that music has impacted you. Perhaps you have loved ones or friends who have found relief in music. For the next few minutes, I would like to focus on a few case studies that illustrate how powerful music can be. Music can have profound effects on premature babies. Although one of my brothers was born with hydrocephaly, he was premature, their hearing did not seem to be impacted. However, for those that are impacted, the use of creative music therapy, CMT, can be beneficial. This type of therapy uses ways to nurture premature babies to improve social contact, as well as response to music. One of the figures from a study by Hasselbeck et al. 2020 shows the various ways CMT can be used to help families. You can also see from another figure from their study showing how active the parts of the brain are when CMT is introduced. In fact, there is a dose-response relationship, meaning that the more CMT is introduced, the more stimulated the various parts of the brain are. People diagnosed with autism and other behavioral health conditions find relief in music therapy as well. Patter et al. 2022 studied the effects of a music therapy program offered to children on the autism spectrum. Here is the abstract of the study. The authors found that this intervention improved social interaction in patients. Military personnel also obtained benefits from music therapy. People living with dementia can also obtain happiness and wellness when using music therapy. The authors of a Cochrane review find that cognitive function, as well as psychological and behavioral symptoms common with dementia, are improved when music therapy is included in the therapy of the person. Music for animals? Yes, of course, animals can certainly benefit from music therapy. In fact, Snowden 2021 provides a comprehensive review on the importance that this type of therapy is able to strengthen their well-being. From our dogs and cats to rodents and apes, music has shown many benefits from the animal kingdom. If we think about communication and sound directed at non-human animals, short and rapid noises cause arousal by increasing pitch of the sound, while a low and long musical note encourages relaxation and calming effects. Still, using a short or sharp explosive sound may indicate for the animal to stop. While researchers provide a thorough review of music therapy, they do point out two specific issues when studying animals and the effect that music has on them. First, researchers are not matching the music to the sensory system of the animal. Second, researchers are unaware that specific types of music cause different emotional reactions. I enjoyed learning many things about the effects that music has on our non-human animal friends. For instance, it was surprising that classical music, such as that from Mozart, the composer, was a fan favorite in the overall animal kingdom. In fact, dogs like the sound of this music so much, they fall asleep. However, they also enjoy rock music. As we look further into the literature, I also found that some apes actually preferred silence or nature sounds to rock music. Our farmland animal friends also get to enjoy music. Lambs enjoy easy listening music. Cattle enjoy country music. Pigs enjoy fast playing music. Depending on whether the music is happy or sad, chickens actually respond with emotional cues. As I was doing research on this music therapy presentation, I wanted to find any evidence of the earliest forms of music in cultures. Interestingly enough, I found that bone flutes that were excavated from the southwestern part of Germany were the earliest known examples of music. This would be over 35,000 years ago. Here you'll see in the two figures from Conrad et al. 2009, an article which depicts the bone flutes. If music therapy is conducted by a trained music therapist, there should be no negative effects due to the goals that are worked on in collaboration with the person receiving the therapy and the healthcare team. However, Silverman et al. 2020, June 30, did study the phenomenon of negative effects. Most of these issues were due to inadequate training. So in summary, we've covered a lot of information about the benefits of music therapy in enriching the lives of people and our animal friends. We first began with a brief review of what this field of therapy is. We also had a quick anatomy lesson of the brain, as this is our interpreting center for sound and music. I was fortunate enough to interview a licensed music therapist. We were able to discuss the results of that interview. And I really hope you were able to learn more about real-world applications to music. I want to thank you all, as well as Drs. Rosser Majors and Sutler Cohen, for hosting the March 2024 Culture of Care Summit. Now, if there are any questions or comments, please feel free to either write them in the chat, or if you'd like to come off mute, we can discuss. I think we have a few minutes left. And then my references are listed after this slide.
Hi, Chris. This is Yvonne. I just some comments. I won't keep it too long because, and as a gerontologist, I have seen the progression and the evolvement of music therapy and its effectiveness with individuals suffering from brain disorder, cognitive disorders, all types of dementia. I've seen it. I mean, it's everyone talks about it. Any Alzheimer's Association conference you go to, it's there. It's being researched. I want to share some sites for you to go to that I think maybe that you haven't seen, particularly in working with persons with dementia. While people might think there's really no progression or improvement to the disease itself because it is a progressive disorder, it does, however, help to kind of manage those behaviors of anxiety, depressive symptoms. They're finding now that there's a lot of nursing homes in my community that everyone has donated their old headphones, and so they put these kind of light headphones on the residents and kind of keep them on for them to kind of help them keep them calm. An important note though, communicating with the person's family that has dementia initially to see what type of music they enjoyed the most in their life, because what I like and the kind of music what you like is going to be very different. So a lot of times in doing training with nursing home staff, we often tell them don't play your music in the facility. Play what you think they would like, because it really does help to change the mood. So I really am just so elated that you brought this topic up today.
Thank you, Yvonne. Richard.
Yeah, Dr. Chris, I am absolutely impressed. I want to thank you for a superb presentation of great content. You did a really wonderful job. Thank you.
Thank you. Dr. Hansen, you had mentioned in the chat, how long does it take to get board certified and go through a therapy program? I would say it takes about 2 years. If you're wanting to go the master's route, bachelor's, you can, but typically it's master's and doctoral programs. So a typical master's program would be 2 years. You do your 1,200 hours of an internship, and then with a doctorate, that's likely an additional 2 or 3 years. But you don't have to be a music therapist to also bring the joy of music to your loved ones and your friends. It's
Sure. Does that include, is it a kind of program where it includes some, really heavy duty anatomy and physiology and that kind of thing? Is it very medical based as opposed to more, social theory?
I would say it's half and half. I would say it's more social theory. I mean, you have to know about the brain, but in my brief anatomy lesson, they really focus on the brain. But yeah, I would say it's more geared towards the social sciences because music in and of itself, is an art and it's also a science, but being a therapist, trying to work with people, I would say that's more on the social platform, if that makes sense. Elena, I know we're almost out of time, so let me know when we need to close this. But Elena, you had a question?
This was great. I actually went to a college that has a private institution that has the only undergraduate Bachelor's of Music in the state of Iowa that's AMA certified. And a lot of it was our music majors. So there were dual enrollments in music therapy and music education, music therapy and social work. So I think like the applications of this beyond sort of working with adults is fantastic. So thank you for doing this. That's really all I wanted to say because I think it's an important overlooked program that has a lot of benefits, and with music education sort of going away in our K-12 schools, I think it's really important to talk about this and what those applications might be to help other students. Definitely.
I posted my email in the chat, so if any of you have additional questions, if you'd like me to send you my PowerPoint so you can go back and look at the PowerPoint, feel free to email me.
Thank you, Chris. You must have been reading my mind, which might be a little scary. I was going to ask you to put your email address in the chat in case anybody wanted to connect with you. What a lively conversation. I think we could have gone on for a few more hours at least. I loved all the experiences you shared and the research relating to music therapy. I think our audience felt the same. So thank you so much again for
welcome
for presenting on this fabulous topic. To everybody, we will have a short break in the Culture of Care Questions Corner. Please join us. I put the information up in the chat. The next session will be right at 12 o'clock, all the way through 12:15. If you want to come for an open discussion to share your thoughts and feedback, we would love to have you. Again, thank you so much, Dr. Chris, and to everybody who has attended. UAGC and the Department of Behavioral Science is grateful for your time and contributions. All right, we will see you shortly. Enjoy the rest of the summit. Bye-bye.